Good evening, everyone. Thank you for joining us for today's webinar. And this webinar is on benefits planning for Asian American and Pacific Islander older adults. My name is Sumitra Murthy, and I'll be the moderator for this session. Um, this webinar has been designed in the form of a question and answer session to provide valuable insights into understanding and navigating the complexities of benefits planning. Whether you're here to learn more about managing benefits alongside employment or understanding available resources or simply exploring various options for your financial planning, we hope that you'll find this session informative and um, empowering, hopefully. So this webinar is presented to you by ASIAAN, which stands for Aging Services Inclusive of Asian American Networks. We are a technical assistance and resource development center for Asian American and Pacific Islander older adults. It's funded by the Administration for Community Living, U.S. Department of Health and Human Services, and supported by University of Illinois, Chicago. So before we get started, just a few housekeeping notes. This session is being recorded and we'll share this record later on our YouTube channel. We have live translation in English. We plan to translate the webinar recordings in multiple languages later and post it again on our YouTube channels. And at the end of the session, if we have time, you can use the chat for any questions and we'll do our best to address them. As mentioned earlier, we are a National Technical Assistance and Resource Development Center addressing healthcare and social service barriers experienced by Asian American and Pacific Islander older adults. Our overall goal is to address healthcare and social service barriers experienced by the AAPI older adults. And we will do this by building capacity for culturally relevant care within service systems, fostering health literacy among older adults and their caregivers, and cultivating cultural sensitivity among future health and social service providers. We are joined by a fantastic lineup of experts who will answer some of the questions we have and guide us through key concepts and also share some practical strategies. First, we have Emily Vichello, who is the Director of Education at the Medicare Rights Center, a national nonprofit consumer service organization that works to ensure access to affordable health care for older adults and people with disabilities. As Director of Education, she oversees the development of Medicare educational materials for consumers and professionals, manages training programs available to State Health Insurance Assistance Program or SHIP counselors throughout the country, and fields questions from Medicare beneficiaries and the professionals who serve them through helpline and email channels. Next, we have Amy Wong, who is the Associate Director of Human Services in CASEL's Community and Family Wellbeing Department. She has been part of CASEL's mission to catalyze the transformation of individuals, families, and the community for an equitable future since 2019. She holds a master's degree in public health and has over 15 years of experience in health programming, including health promotion, disease prevention, and reducing stigma around disease and illness. Amy also has a certificate in managed care. She has spent most of her career in nonprofits and social services, and she uses her knowledge and experience to help immigrant communities. Then we have John Marshall, who has been with the Social Security Administration for more than 42 years, and since 2000 coordinates 25 work incentive liaisons in the 23 Social Security Administration offices in the Chicago metropolitan Northern Indiana area. He works under the area director. He's also the point person for SSA to outreach and collaborate with people with disabilities, with other agencies, and advocates in the Chicago metro Northern Indiana area, and to help people with disabilities to work if that is what they want to do. He also has been the SSI, SSDI Outreach Access and Recovery, also called the SOAR, and homelessness coordinator for the Chicago metropolitan Northern Indiana area since 2010. He's SSA's representative to work with advocates, service providers, the homeless themselves, and the 19 Illinois SSA offices in his area to help homeless individuals get the services and resources they need to potentially get off the street. Working with partners in this endeavor, he also trains them to take supplemental security income applications from the homeless and fast track those applications to get the homeless the money they could use to leave the streets and find residences. And finally, we have Radhika Subramanian, who is a public benefits specialist at Metropolitan Asian Family Services. Radhika provides services to diverse ethnic communities in the areas of Medicaid, SNAP, Medicare, Social Security, retirement benefits, social supplemental insurance, marketplace health insurance, also referring clients to respective counties and townships for housing and energy assistance programs. She's a SHIP counselor with the Illinois Department of Aging and helps Medicare beneficiaries with signing up for Medicare Supplement, Medicare Advantage, and prescription drug plans, as well as identifying clients who need extra help with drug subsidies. And Radhika takes pride in helping every individual who seeks her assistance. So without further ado, let's dive into the question and answer session right now. So the first topic that we are going to bring up is Social Security. And John, who is our expert, will be answering some of these questions. So John, the first question that we have is, what is SSI and who is eligible for SSI?
Well, SSI is a needs-based program that's administered by the Social Security Administration, and really the only way that you can be eligible for it is if you have low income and low resources. And typically we look at what your food, clothing, and shelter needs are going to be, and what they need to be in order to be met. And so ultimately, it's been directed federally since 1973, before it was within the states, and it was being done in all sorts of different types of ways. And that's why it came to the Social Security Administration. So it came in 1973, and we administered that as well. Now, the people that are eligible for it are, U.S. citizens or qualified aliens, or what we call qualified aliens, people who have some type of immigration status with the Department of Homeland Security, and people who meet the other qualifying eligibility requirements we have for being eligible for supplemental security income. Like if you were here before the August of 1996, you will be eligible. Or if you had worked and earned more than 10 10 years worth of income, then you would be eligible as well if you came in after 1996. But those are the folks, all the people that all the people that meet the categories citizen or qualified alien, or and under the age of 65 will file for social SSI disability. But people over the age of 65, they'll be filing for Social Security age benefits, where we wouldn't have to make a disability decision. We just need to get your proof of age, and then and have you be one of those categories of folks that could potentially be eligible for SSI. So that's SSI in a nutshell.
Yeah, thank you so much. And next is the follow-up question. So what is SSDI and how do people 65 and up apply for it?
Well, see, Social Security disability insurance, and it's kind of similar to Social Security retirement insurance, and I'm sure we're going to get into that question in a minute. But Social Security disability insurance is based on people paying the FICA taxes. Like when you work and you have all those deductions taken out, you have the federal income tax, you have the state income tax, and then you have FICA, that's us, that's Social Security, and then you have Medicare. And then I think some other folks are going to talk a little bit more about that. But but FICA is the Social Security tax. And so you have to have worked at least 10 years worth of work in order to be eligible for Social Security disability insurance. But not only that, but you have to have worked 5 of the last 10 years, before you became disabled. So that in order to be insured for Social Security disability insurance. And so it's an insurance-based benefit as opposed to a needs-based benefit like SSI. And so, depending on how much you pay in FICA taxes will determine how much you're going to be getting in your monthly Social Security disability insurance check. And if I was to go into the retirement benefits, it's pretty much the same thing, at least in terms of eligibility. You have to work those 40 quarters, what we call 40 quarters, and that's 10 years worth of work. But then, but you can retire and get a lesser retirement, early retirement at age 62. But then, if you're born after 1960, then you have to wait until you're 67 until you get able to get your full retirement and get the full benefits that you paid into the Social Security system.
Yeah, wonderful. Thank you. That explains what the differences are between SSI and SSDI pretty clearly. But what are Social Security retirement benefits then?
Yeah, that's what I was talking about there. That's when if you were not disabled, and then because if you're disabled and you get determined to be disabled under Social Security disability insurance, even once you got into your 60s or into the full retirement age, you'll be getting paid as if you were fully retired at your full retirement age. With Social Security, retirement benefits is based on has nothing to do with disability. It has to do with your age. And if you could file earliest you could file for Social Security retirement, it says age 62, and you get about a third less than you would typically get at your full retirement age. And then each year that you get closer to your full retirement age, and you start receiving the retirement benefit, it gets a little higher, but it's still going to be less than what you get at your full retirement age. Typically, people that not typically, everybody who's born after 1960, full retirement age is going to be 67 now. If you were born in 1959, it's 66 and 10 months, and that'll be your full retirement age. And then if you were born in 1958, 66 and 8 months, and then so on and so on. It goes back as far, goes back pretty far. So that's how that Social Security retirement in a nutshell is still based on that FICA tax that you pay, when you work ultimately. And really, when you pay that FICA tax, you're paying the benefits of the people that are receiving the benefits now. So if your work that you're doing right now is helping the individuals who's receiving Social Security disability insurance or receiving retirement benefits or receiving survivors benefits or auxiliary benefits on with Social Security.
Yeah, thank you so much. I think this kind of clearly, explains the differences between SSI, SSDI, and then what are, the retirement benefits. Now we will move on to, thank you, John. And now we'll move on to a question on SNAP. Anyone who can answer that from the experts, but what are SNAP eligibility requirements for people 65 and up?
So for people 65 and up, they should have completed 5 years as a legal permanent resident or 5 years on the green card. And they have to show need that they need the food stamps. Now, generally when SNAP is the way we are trained to file for SNAP is if they live with somebody, the entire family, if they live with their children, grandchildren, is considered a SNAP unit. But if the individual or the couple, or if there are 3 people, they're living separate, they can get together and they can apply for SNAP. Now, SNAP does have income requirements, and I just have to pull that up. So the 2024 SNAP income guidelines just were published in October. So 165% of federal poverty level it's 2,071. So anyone above anyone above the under the income of 2071, that's a single member, can apply for SNAP. Now for two people it is 2811. Then there's a secondary guideline which is 100% of federal poverty level, which is 2510 for a single person, 3406 for two people. It keeps going up based on the family members, because SNAP can be applied either individually, either for couples, or as a whole unit if they're living with their family, their children, their grandchildren. So
Thank you
the
so
main
much.
thing is their income limit, their income,
Yes.
and the asset for SNAP at any point of time cannot be more than, for 65 and up, it's $2,000 for a single person and $3,000 for a couple.
That's good to know. And especially since, this is the most updated one since October. I'm glad, you brought this up and you could address that. And by the way, SNAP means Supplemental Nutrition Assistance Program for those who are not well versed about it. Thank you so much, Radhika. Now we'll get to the questions on Medicare and Medicaid. And Emily, you can jump in, or Radhika. So the first question really is, what is the difference between Medicare and Medicaid, and how do they work together? That's, I think, the most common question that people might have.
Yeah, so I could get this one. So for Medicare, it's essentially a federal health insurance program for individuals 65 and older, or individuals that have received disability benefits for at least 24 consecutive months. There's actually 4 parts to Medicare. There's Medicare Part A, which covers hospitalization up to 80%. Medicare Part B, that covers your doctor's visits and your screenings. And then there's also Medicare Part C, which covers, which has to be purchased in addition to A and B. So that would cover the remaining 20% of anything not covered for Part A and Part B. And there's also Medicare Part D, which is for prescription drugs. As for Medicaid, it's a state health insurance program, and it's for individuals that are low income or have limited resources. So those are the essential differences. They work together for seniors or individuals with disabilities, where Medicare is usually the primary payer of services. And then for anything Medicare does not cover, Medicaid would come in after that.
Okay. Yeah. Now, a follow-up question would be, what does Medicaid not cover, and what does Medicare not cover?
So Medicaid covers almost everything. So Medicaid is called the insurance of last resort. It is based on very low income guidelines. The current income guidelines for seniors 65 and up are $1,255 for a single person and $1,703 for a couple. So if you're under that income guideline, you can apply for Medicaid. You will get and the asset limit has actually gone up after the pandemic. So for either one or two people, the asset limit is $17,500. So if you're under all these ballpark income guidelines, you can apply for Medicaid. Medicaid covers everything. Medicaid covers long-term care insurance. Medicare does not cover long-term care insurance. You have to buy that separately. So
Okay.
Medicare also does not cover, so Medicare covers only 80%. It does not cover dental health, and it does not cover dental, vision, and hearing. And you do need a supplement insurance to take care of that 20% co-insurance, deductibles, etc. And generally, when for low-income seniors, Medicare, like Amy just said, Medicare will be the primary, Medicaid will be the secondary, and that's how they work. Whatever Medicare does not pay for, Medicaid will step in and pay.
Okay. Yeah, thank you. But when someone turns 65 and enrolls in Medicare, how does that affect their Medicaid eligibility?
That should not affect. So when people are on the cusp of turning 65, and if they have been on Medicaid, the Department of Human Services, the local offices will start sending them notices saying that there is something called a transition. So at that point, they know that they're going to transition to Medicare if they have worked and paid into the federal health system of Medicare. They have to have paid 40 quarters or 10 years of taxes. So then they become Medicare eligible. And at that point of time, they become Medicare eligible. So A is automatic. They don't have any premium. It's premium free because they've already paid for the 40 quarters. And then Part B does have a premium, which is $185 starting January 1, 2025. That will be absorbed by the state because they had Medicaid. So when you apply for Medicare, you have to go through Social Security. Medicare Part A and Part B the application process goes through Social Security, and then Social Security sends the state DHS. It'll pass on the application saying that, hey, this person has a premium, this is low income, and the state will absorb whatever Medicare does not absorb. So the Part D drug plan, the 20% coinsurance, the premiums, everything will be taken care. So generally when they turn 65, they don't have to worry. If they are on Medicare, they are on Medicaid and they are Medicare eligible, everything happens pretty smoothly. If they hit any roadblocks, it's not a big deal. They just have to look for SHIP counselors or go to the DHS. There's tons of help available out in the state of Illinois.
That's actually good to know, I'm sure, for our attendees, because that would have been a worry, right? Like what would happen once we turn 65. So it's good to know that it's not that hard, and the transition can go smoothly. There are a few more questions on Medicare and Medicaid, but we'll come back to that after we ask questions on employment and benefits and traveling. And if we have time, we can get back to that. But coming to Medicare and employment, what if someone is retired and receives comprehensive health insurance from a former employer? Do they need to sign up for Medicare Part B when they turn 65?
Yes, they do, because this person, I assume, is retired, right? He's just receiving the retiree health insurance, correct? So they do have to sign up for Medicare Part A and Part B, because when they retire, we do not know how much of that retiree comprehensive health benefits they are getting. So in that case, we generally ask them to check with their benefits coordinator who is controlling those retiree benefits, comprehensive benefits, and make sure it's creditable coverage. And then they do sign up for Part A, Part B. And if they retire, if Medicare might become the primary because they're 65, and then their retiree coverage will be their secondary.
Okay, that helps, to know.
Yeah. Could I add one thing on that as
Yes,
well?
please.
Yeah,
Yes.
in addition to what Radhika mentioned, sometimes a retiree plan might, once you turn 65, it might become a Medicare plan, or it might become a Medicare supplement. And so, as Radhika mentioned, it's really important to talk to your benefits administrator and say, I'm turning 65. How might my coverage change when I turn 65? But the advice to enroll in Medicare at age 65 really stands. We don't want people having penalties or not having primary coverage, mistakenly, delaying enrollment because they have this retiree coverage. You should almost always enroll in Medicare at age 65 when you have retiree benefits.
And there is an enrollment period, so they have to be inside that enrollment window. Otherwise, they are going to incur penalties. And especially with Part B, like it's 10% every year, they have stretched out. So say they're 5 years late, the penalty is going to be 50%. So 185 plus 50% is going to be a big amount. So they have to be very careful. And that's why we kind of constantly do a lot of outreach. SHIP sends out notices, DHS, Social Security, everyone is doing outreach at their end just to make sure people are aware of this. And also the drug plan. Now, again, that retiree comprehensive coverage has to have a creditable drug plan. If the plan is not creditable, and say the senior is having like 10 or 15 medications, it might be an issue. So it might be better to take a drug plan, which is currently, I think the drug plan premium is $36.78, but Illinois has a very good benchmark plan where they probably pay $3 or $4. They also have $0 plans. So, and the other thing is sometimes we just coax people to just take a drug plan, to take the bottom level drug plan. Otherwise, you will incur penalties if you don't take the drug plan at the right time also.
Okay, that is very helpful to know, because sometimes, people might decide that I might not need the drug plan, but then later if they want to, then they have to incur penalties. So that's good to know. Okay, another question is, what is, someone is about to retire and their employer has offered them 18 months of COBRA coverage. Can they delay signing up for Medicare until the COBRA runs out?
Yes, generally COBRA runs only for 6 to 8 months. 18 months has the person lost the job? Is that why they have 18 months of COBRA coverage?
Yes.
So I would have them check with their HR coordinator, benefits coordinator, make sure that they have COBRA coverage till 18 months. And generally after that coverage ends, they have 6 months to sign up, which is again a special enrollment period. It's called an SEP, and they have to sign up for their Part B, everything that was not covered within that 6-month enrollment period, a drug plan. But the most important thing is generally COBRA has sometimes, even though they have the 18-month COBRA coverage, it might not be comprehensive enough. So it might be better to just go ahead and take the Medicare Part A, B, and the D and have the COBRA as that supplement insurance. So this is something that they have to check with their benefits coordinator or their HR coordinator in the company from where they have been given that COBRA coverage.
Okay. Okay, so you're saying that, it's better to take the COBRA, better to take the Medicare irrespective of them having COBRA.
It's
So
good
that,
to take it, but they don't, because again, now they're going to have that Part B premium. The Part A should be fine if they have their 40 quarters. The Part B, they'll have a drug premium. So they need to check. If they think that the COBRA coverage is creditable, everything is being taken care of, they can push it. But 18 months seems a little bit kind of stretched out if they're 65 plus, because Medicare is administered at 65. So they definitely have to get into it and check. There's also, they can be advised to check with SHIP counselors, check with Social Security, check with agencies, area agencies out there that are guiding them for the signups.
Yeah, and I would also add, when it comes to COBRA, Medicare has rules about who pays first when you have other insurance and who pays second. And with COBRA, it pays second to Medicare. So it's also important to sign up for Medicare, even if you're being offered COBRA coverage, because Medicare is supposed to pay first. And we sometimes see issues on our helpline at Medicare Rights Center where somebody kept their COBRA coverage, and COBRA is very expensive usually because your employer stops paying for that premium. And so people think, I have this expensive coverage, I don't need Medicare, and COBRA might mistakenly pay for your services and then later on down the line say, oh, you're 65, you were supposed to have Medicare. And there can be problems that come from that, which SHIP counselors, of course, can help you with. But if we can avoid the problem and have you sign up for Medicare, if you're 65 or older and you're retiring and your employer says, we'll offer you COBRA, or you lose your job and you're offered COBRA, that's totally an option. But we also recommend enrolling in Medicare so you have that as primary. And then, if the COBRA is really helpful and comprehensive, you can keep that as well.
yeah. Thank you. Thank you so much. And now another scenario that I want to present to you. What if someone wants to continue to work after turning 65 and their employer's health insurance is a high deductible health plan paired with a health savings account? And how would this fit in with Medicare?
Okay, so the high deductible health plan is you pay into the health savings account pre-tax dollars, right? That's going to stop at 65. So that's not going to, because the reason you had that prior to you were turning 65 is because that was a private insurance, but then you have creditable insurance once you turn 65. And you've already probably worked for 10, 20, 30, 40, whatever years. So what's going to happen is your employer is going to say, hey, we're not going to let, because those are pre-tax dollars. So you're not going to be, and generally high deductible plans are for people who are basically very healthy. You probably even end up paying the deductible first before you have to pay up to the deductible, right? And then, so basically, if you have a high deductible plan, again, check with your benefits coordinator. And what you can do is they will definitely stop. You can continue contributing into the HSA. But if you sign up for Medicare, you can use that HSA money as your co-insurance to pay your deductible, Medicare deductibles. You could to pay your co-pays. That can be used for all this once you turn 65. But again, if you're in a high deductible plan, the employer is going to deny you putting into that health savings account because he knows you have you have the option to sign up for Medicare. So it might be better to take Medicare, stop pay, and you're not going to, and then those are those pre-tax dollars. So use that towards your co-pays, your deductibles, your co-insurance.
Mhm. Yeah, that's good to know. Now, Amy and Emily and Radhika, any other scenarios that you can think of with regards to Medicare and employment that could come up and that people need to know about, other than these that I had presented?
So if the person is working after 65, there's a lot of people that work till they're 70, 72. And if they have creditable health insurance, so if the company has more than 20 employees, and they have good insurance, which is called group health insurance from their company, they can continue to be on the company's group health insurance or the firm's group health insurance. And they can just sign up for Part A. Part A is anyway premium free. Once you turn 65, you probably have hit 10, 20, 30, 40 years of service. You should have completed 40 years of service, 40 quarters, which is 10 years of service of work history. And paying into Social Security and Medicare taxes. So what you can do is you can just sign up for your Part A, which is going to just be there, and you can have your group health insurance. But one important thing to check is if the person who is 65 and up is on a bunch of medications. So there's a lot of people that are in all those high cost. There are seniors who have 3 different prescriptions for diabetes. They have 3 different insulins. Insulin is capped now at $35 per prescription, so that's okay. But then there's drugs like Elixir. There's all kinds of drugs, Jardians and things like that. So if you're on any of those kinds of drugs, you have to make sure that your group health insurance has a creditable drug plan. If not, it might be better to take the Part D plan. And check and say, hey, and sometimes what employers will do is they might have tie-ups with certain pharmacies, and it might be cheaper to have those drugs while you're working with your group health insurance plan. Or sometimes it might not. It might be better to have a Part D drug plan. So if you're working after 65, you're working to 70, 72, it's all, again, you have to check with your benefits coordinator. And once you stop working, say you stop working at 67, 69, you have up to 6 months to sign up. That's your special enrollment period to sign up for Part D. Part B, which is the outpatient health insurance, doctor visits, physical therapy, x-rays, all that kind of stuff. And you have an additional 63 days to sign up for a Part D, a drug plan. But if you're already drawing early Social Security benefits, like John said at 62, when you turn 65, if you do not let Social Security know, they will send you the Part A and the Part B card automatically. And then you have to let Social Security know saying, hey, I'm working. I'm working, but obviously you're going to draw less because you started drawing from your Social Security, so you can only work so much. But I still have coverage through my employee health insurance program. So you just take the Part A and hold on to the Part B, because you do not want employer health coverage plus that 185 premium.
Okay. Yeah, that is helpful to know. Now, John, I have a question for you though. Can someone who is on SSI or SSDI work?
Yes, it's always in your best interest of somebody that's on SSI to work because we count less than half of their wages against their SSI. You can make $1,000 in terms of wages and and still get around $450 worth of SSI. And the full amount of SSI now is 943. So it's always going to be in your best interest to work while you're in SSI because you're always going to end up getting more money. And you're also going to be considered to be eligible for Medicaid, and you have to make more than $34,000 now in order for us to even question your eligibility for free Medicaid in the state of Illinois with no spend downs. And even then, I've seen people that made, $60, $70, $80,000 a year. And because they used their Medicaid so much, they were still eligible for free Medicaid in the state of Illinois. So it's always going to be to your advantage when you're working, when you're on SSI. Now, Social Security disability insurance, I often use the example of a famous person. Let's say Taylor Swift fell down the stairs and she hurt her back. She would be eligible for Social Security like everybody else because she probably paid a whole lot of FICA taxes. But let's say maybe a few years down the road, or maybe even a few months down the road, she starts feeling better and she can go back to her concerts and do her concerts and do her studio work and make whatever gazillion dollars she makes when she, who knows what that one makes. Well, she could do that for 9 months and still get all of her Social Security check. So I call those, and I used to jokingly say those are the Beyonce or the Taylor Swift months. But once we get to the 10th month, you have to be making less than the substantial gainful activity amount, which is $1,550 a month, gross a month. If you're making more than that, then you're not going to be eligible for a check that month. Or if you're making like $1,549.99 or less, you can keep on getting your check while you're working. So it really depends more on how much you're working when you're on Social Security disability insurance. Plus, your Medicare is going to continue from when you started working for at least 8.5 years after, while you're working. So you don't have to worry about losing your Medicare either, once you start working. And then if you have to stop working, and if your benefits are stopped while you're receiving Social Security disability insurance, and let's say, and you within 5 years, you can come right back on and not have to file all over again and start getting your checks back. So it's really more often than not in your best interest to work while you're in Social Security disability insurance. And with SSI is always. Now when you're early retirement, if you retire at age 62, if you retire at age 62, you're going to have a overall income limit of $22,000, I think it's $650 now. And for every $2 you go over it, $1 will be taken out over your check. So you have to keep under that, $22,650 amount and still receive your retirement check. Once you get to your full retirement age, though, all bets are off. You can make, like I said, Taylor Swift money and still get all your Social Security check once you get to your full retirement age. So, so that's how work kind of affects the Social Security benefits in a nutshell.
Thank you, John. So I thought of another question quickly, is that do I have to enroll in Medicare if I continue to have health coverage after age 65 from my own or my spouse's employer?
Yeah, so we just covered that. If you have health insurance from your spouse or your own, so you're still working, right? You or your spouse are still working, correct? Someone is
Yes.
working. Okay.
Yes, someone is working.
Yes. So again, as I said, if the company has the firm has more than 20 employees and they have creditable group health insurance, you can continue to stay and you can delay taking your Medicare. After you stop working or your spouse stops working. Now, sometimes the coverage for the employee might be different than for the spouse. So you have to check that. So say I'm working, I'm getting at 65, say my husband is 70, he's working, and I'm 65. And we're both covered under his employer's insurance. It might be a little different if I'm not working. There might be more coverage for the employee than there might be for the spouse. So we have to check with the benefits department, the HR coordinator, make sure before saying yes to the group health coverage or continuation of that and saying no to Medicare. Because the reason we emphasize so much on this is, for some reason, if there's coverage gaps, it's called gaps in coverage, and something's not covered and we delay signing up, we're going to incur penalties. So those are things. And generally for the person who is employed, things should be okay, but it's always good to check at 65. I do have clients who are working at 70. They're only on group health insurance. They've just started Part A because that's premium free. I do have people who are 70 working, started Medicare AB, have a drug plan. So in that case, the group health insurance is primary because they're still working. Medicare is the secondary.
Okay. Thank you, Radhika. Before we move on to the next topic, which is benefits and traveling, Amy and Emily, is there anything that you would like to add about, Medicare and employment?
There's two more conditions for Medicare, like if you have ALS, Lou Gehrig's disease, so there, in that case, and ESRD, end of stage renal disease, Medicare starts much earlier. So if there's somebody who's 57 who is having dialysis, kidney transplant, kidney dialysis, they have up to 30 months, the whole coordination process, and Medicare starts for them. And similarly, people who go through ALS.
Okay. Thank you. Thank you for, telling about those caveats. Now let's go to benefits and traveling section. And the question is for all of you. So does Medicare coverage vary by state? And what happens in case of out-of-state emergencies?
So Medicare is a federal health program. So Medicare is the same in all the 50 states. So Medicare will work. Now, if you go out of state, if you're on Medicare and Medicaid, you might have to contact your state Department of Human Services saying, hey, I'm traveling and this so-and-so has happened. I've had an emergency, and they might be able to work that out with the other state and pay for you. Now, if you're on Medicare and if you're above income and you're on Medicare and a supplemental income, supplemental Medigap policy, or you're on Medicare and a Medicare Advantage policy, now Medicare Advantage and Medicare supplement policies work by zip code. Medicare supplement policies are based on the state in which you are in. Medicare Advantage policies are based on your zip code. You might have to call them. Medicare, so your 80% is going to be taken care of anywhere in the US. But for that 20%, whoever is covering your supplement or your secondary insurance, you might have to contact them and figure out how to work. So most likely they might have partners, like say you have BCBS of Illinois, BCBS of Texas. They might be able to work with their partners there. We're not very sure with other states because I'm trained for Illinois. So that's something, or you can just call, even if you call Medicare, Medicare would not know about those supplemental or those secondary insurance programs. So it might be best to call that secondary insurance that's taking care of the other 20%, and they might be able to guide you on how to move about.
Thank you, Radhika. Emily, do you want to add to that as the Director of Education for, Medicare Rights Center regarding other states? Something that you could
Oh,
tell us?
yeah, sure. Yeah, since our nonprofit is national in scope, we do get questions from people in different states. For the supplemental policies that Radhika mentioned, when you have original Medicare, the A and B, and then you get the other plan to pay for the 20%, you usually can move around with those, but it's great advice to contact the policy itself and say, oh, I'm moving, do you have partners in this state that I'm moving to? Can I get a policy there? But in general, when thinking about the best type of coverage for someone who's traveling to different states, maybe you have family, friends throughout the country, original Medicare is a pretty good option because there's no network and you can go in different states and your doctors will still take original Medicare. But there are also the Part C plans that Amy mentioned, or Medicare Advantage. You probably see a lot of advertisements for them around this time of year. People are calling you about them. They are offered by private insurance companies. They provide Medicare, but as Radhika mentioned, it's by zip code or by the state that you live in. And so if you do go out of state, you're probably out of network and you probably don't have coverage, which means you owe like the full cost of the service, except for an emergency. So we don't want emergencies to happen, but if one does while you're traveling out of state, your private Medicare Advantage plan, your Part C plan should cover you even though you were out of network because it was an emergency. So that's one exception to the rule with the private plans. Normally out of state, they don't work unless it's an emergency. Amy, I don't know if you have anything to add to that as well.
Okay, thank you, Emily. But now I have another question. Can you retain your public benefits if you travel out of the country?
No, you cannot retain anything if you travel. Medicare does not work outside the country. Generally, we tell people if they're, so the basic policy of the Department of Human Services is, say you're traveling to your home country, or if you're a person who's traveling to India, Pakistan, any of the European countries, anywhere for that matter. So we tell people to call the DHS, call the county office, let them know that they're traveling. So they'll put it on hold, but they only put it on hold for 60 days. Now, if you're getting SNAP, you have to let them know, because that supplemental nutrition assistance program is only when you're living here. It's not, that money should not be coming into your account and because that's like a debit card. So you cannot have that money in your account if you're traveling out. So you have to let the DHS know that, hey, I'm traveling. I'm gone from maybe January 1 to March 31st. And generally, if you're out of the country for more than 2 months, they might even say that, hey, you know what, we can't hold it. You have to come back and reapply. I just had a client today who's traveling this weekend and he's going to be gone for 95 days. And he put his SNAP on hold, and he tried to put his Medicaid on hold. He also gets community care program CCP services. And the DHS told him that, you know what, yes, we have everything on hold, but we might cancel everything. You have to come back and reapply because it's beyond 60 days. And he's going to be gone for 95 to 100 days. So nothing works when you travel.
In terms of the Social Security, the Social Security disability insurance check and the Social Security retirement check can be tricky. You can take that out of the country, but with SSI, you cannot be outside of the country for a full calendar month. So ultimately, it'd be okay if you went for a couple of weeks or something like that, during the month. But if you spend a whole month outside of the country, you are going to be overpaid for that month. So you can't get SSI outside of the country, but with Social Security, you can.
Yeah, and even for the medical and everything is 1 month. But sometimes they're okay. They will let you do it for 2 months. But everything is 1 calendar month.
Yes.
Yeah, thank you. Emily, do you want to add to this? Do you get any questions on, traveling abroad, and do you get this kind of inquiries?
Yeah, we do sometimes. The only thing that I would add to what Radhika and John mentioned is that it's difficult with Medicare because it doesn't work outside of the country, outside of the US rather, but for people, a lot of people are like traveling back and forth. And so then they wonder, should I keep Medicare? Because if you disenroll, you might later have a penalty if you return to the US. And it's hard to plan for the future. It's hard to know, will I be living outside of the United States for a long time? Will I be coming back? And so you have to weigh, the cost of the premium. You can keep paying for the premium for Medicare while you live outside of the United States, but then, you're paying for something you can't use. You're just paying for that benefit when you come back to the US. But if you disenroll from Part B of Medicare and then you come back, 55 years later, you have a 50% penalty. And so would it have been worth it to just pay the premium that whole time? That's, we can't really make a generalization about that. I've seen people make like Excel spreadsheets and stuff to try and calculate this. But it all depends on how long you're going to be outside of the United States and if you plan to come back.
That's an excellent point. What Emily said is an excellent point, because I do have clients that travel for 6 months and they're like, I don't want to pay that 174. They cancel it. They come back, they incur penalties. So that's something very good that Emily brought about.
Yeah, good. So can you say a little bit more about who a ship counselor is and how seniors can find one? And is that counseling available in different languages?
Yeah, Emily, you want to go ahead?
Sure. I mean, I love the ships. They are really amazing resources, both in Illinois and throughout the United States and Puerto Rico, US Virgin Islands, Washington, D.C. They all have their own counseling programs. They're state-based, and so they can provide information about the supplemental policies, the drug plans, the Medicare Advantage Part C plans available in your state. They are unbiased, provide one-on-one counseling, and are just really good resources. And I think, Radhika, as a ship representative, really shows like how expert they are. And so I can put in the chat the website to find the ship if you're outside of Illinois and you're in another state. You can go to shiphelp.org. And there's a little button that says find local Medicare help, and you can find the number for your state. And yeah, they're a great resource.
I'm a big fan of ships too, and so is Social Security. We've always maintained a really great relationship with our ships, and we try to do as many things as possible with each other.
Yeah, Illinois is a great state. The IDOA ship program and Social Security, we really work with one another, and we do get we should be very thankful. There's a lot of things that Illinois does extremely well.
Emily, thank you for sharing the website and the phone number, and that will be helpful. We'll pass that on to our attendees as well. And this might be the final question, really. We are almost time, but if we have parents 65 years and older who have a green card, but only spend 6 months out of a year in the US, can they be eligible for Medicare?
Have they worked and paid into the federal tax system of Medicare?
Yeah, well, let us think of both the scenarios. They would have paid or not. Can you
Okay,
tell?
so if they've not paid and they're on a green card, they're not eligible. They can buy it after they've completed 5 years on the green card. So, which is going to be very expensive, $518 a month for Part A, $185 a month for Part B. You need to have a drug plan, and it's going to be really expensive. You might be better to be on Medicaid at that point, if based on your income and resources. Again, Medicaid is again based on income and resources. Now, if they've worked here and they're back and forth, it's no problem at all. But like Emily said, they cannot stop paying their Part B premiums. Say they're staying 6 months here and 6 months there. At no point of time should they stop the Part B saying that, oh, I'm in India for 6 months. I'm not going to pay that 185 times 6, which is close to $1,200, because then they come back, they're going to incur a penalty. They can only apply in the general enrollment period of January 1 to March 31, and they'll hit a penalty. So that's something to keep. But if they are working here, they're 65 up, and they finish 40 quarters, they're eligible for Medicare. And if they're under the income, then they can be dual eligible with Medicare and Medicaid. based on their income and asset limit.
Okay. Thank you so much. Maybe we might have just one more question from our attendees. You can put that in chat because we're running out of time, but this was really helpful, and I hope the experts here have answered most of those questions. So does anyone have any question? Just one question that we could take? Well, if not, I think we will be ending our session. Thank you so much. But before we leave, we'll be launching the feedback poll um, right now. So please do take that poll before we end. Emily, Amy, John, thank you so much for this presentation and answering our questions. And we truly appreciate your time spending. And I hope our attendees have learned a lot through this question and answer session.
One of the things I was going to tell, and then we were discussing this a little bit earlier, Sumitra, was that I have a comprehensive two comprehensive PowerPoints, one on Social Security and disability and SSI, and one on retirement that I'm going to send so that you guys can use and potentially put on your website, so the attendees will also have access to that. Now, they'll get into some of the, just the surface stuff of, of Medicaid and Medicare. And, I always encourage, like I said, I'm a big fan of SHIPs. I always encourage everyone when they have an issue in this, really particular about Medicare and Medicaid, contact your SHIP.
Yeah. Yeah, and we will do that. We will share that resource with our attendees and we'll put it on our website for sure. And I think, are people taking the poll further, or? I guess so. Yeah. Thank you. Thank you. And this was wonderful. And thank you all for attending as well. Yeah, thank you. So this is the end of the webinar, and hopefully we'll come with more webinars on important topics. Thank you.
Thank you. Have a great evening, everybody.
Thank you. Thank you, Amy. Thank you, Emily. Thank you, Sumitra. And thank you,
Yeah,
John.
have a great evening, everybody.
Thank you, everyone. This was great.
Mhm.
Take
This
care.
is-
Thank you, everyone.